Well, in the next 20 years, hip replacements are expected to rise 174% and knee replacements even more. Get this, 673%. Pretty astounding. But thanks to new technology that was once invasive, now can be done with quite ease. And here to explain a little bit more is Dr. Len Kolstad, an orthopedic surgeon at Midstate Medical Center. Doctor, thank you so much for joining us here today on CT Style.
Thank you, Ryan. Nice to be with you.
So, Doc, tell us a bit about the past of these types of surgeries. They were a little bit more invasive?
Depends upon what type of surgery you're talking about. Total hips came into this country in about 1960, and they evolved from cemented prostheses to uncemented prostheses. Total knees came in afterwards. There have been a lot of them done, and they're generally two of the most satisfying operations done now in terms of patient satisfaction and numbers done.
Now, why have the percentages risen so much in the past for having more knee and hip replacements?
Well, because now you're getting into the era where baby boomers are looking to be more active, and there are 80 million baby boomers in this country alone right now, and we're just getting to the tip of the iceberg. And patients are generally more active,
sure.
Bicycling, running, every kind of sport, into retirement.
Playing golf, you're a golfer, you're out there playing a little bit of golf.
I try.
Yeah.
And they want to be pain-free, and I think that probably most everyone now either has a family member or knows somebody or has had a hip or knee replacement, and generally it's a satisfying operation, and so more people are pulling the trigger and having it done.
Let's talk a little bit about the new knee procedure that you guys have over at Midstate Medical Center. It's pretty revolutionary.
Well, the procedure itself isn't new. The method of installation is what's new, and it's done with a robot. It's called MAKOplasty. There's an arm, a robotic arm called the Rio. And when you're talking about a hip replacement, you're talking about essentially two operations, taking the cup portion of the hip and taking the ball portion of the hip and replacing both.
Well, we have a little bit of video here. First, we're going to have you talk about step one to map out the knee. So what exactly are you doing here during the procedure?
Okay, so now we're looking at a hemi replacement of the knee. The Mako at this point does not do the whole knee. What we do is a portion of the knee. So the knee is generally divided into three compartments. So we can do the medial, as you see on the TV screen, or the lateral, or you can do the patellofemoral joint. So essentially you take a CT scan of the knee, and from that we can map out, prior to surgery, just in three-dimensional terms, just exactly where we want to place the components.
And then how about resurfacing? That's step number two. What's happening
Well,
here?
the resurfacing, essentially what you're doing is you're burring off the surface after you've established just exactly how much you want to take off by your computer-generated image.
Okay.
And so what the robot allows you to do is take off to a 0.5 millimeter just exactly what you want to take off. If you haven't done enough, it will show you on the map that you haven't done enough and you do more. If you try to do too much, the arm will stop you from proceeding.
And then the final step, putting in the actual implant.
And then the implants are put in as trials. Now, if you're not happy with the trial, in other words, the robot doesn't do the operation. We do the operation. The robot allows us to put the components exactly where we want. At the time of surgery, you can't see the overall alignment of the limb very well. So we can tension this through a full range of motion. And if clinically we're not happy with it, we can reprogram the robot and take more or less to get exactly the overall alignment we want.
Who is this surgery perfect for?
Well, this unicompartmental knee replacement is good for somebody who is younger and active and who doesn't want the pain of a total knee replacement or the possible downside and the long recovery. You do it when only one part of the knee is involved, not the whole knee. If the whole knee is involved, you're doing the total knee replacement.
Doc, thank you so much for joining us. I feel like a lot of our viewers out there are feeling the pain, no pun intended, but for more information, all you have to do is head on over to midstatemedical.org for a little bit of information on MAKOplasty. Doc, thanks again one more time. And Marisol, absolutely, we're going to send things over to you.
All right.